Namaste. In today's video, I am going to deal with vomitings and diarrhea in children, how it should be treated, what to do at home, when to go to hospital. This treatment and methodology you can follow in adults also in a varied dose of medication. Okay. First of all, welcome to my channel, DR.SwarnaBalaji, online Ayurvedic treatments. Here, if a child is exposed to various kinds of bacteria and virus in the atmosphere while they are playing with the children, then they may expose to a kind of disease, a kind of bacteria or virus. With the children who already exposed to cold or cough, then at that time, if your child is not hygienic, if he is not washing his hands properly and he ate anything, then the virus may enter into his stomach and that may cause to a disease. So first thing you have to do is, after playing or after coming from a school or playing, they have to wash their hands properly. That thing you have to do. But this we can prevent. This is the precaution for a child not to expose to virus. Okay, next thing is, if the child is already exposed to the virus or any kind of infection, then it causes diarrhea or vomiting in your child with no cause, like with no cold and cough. If diarrhea or vomiting seen in a child, then you can give normal kind of breastfeeding if they are less than 6 months of age, or he or she may be greater than 6 months of age. Then you can breastfeed. Along with that, you can give solid food with a minimal quantity which you have already introduced to the child. Along with that, you have to give an ORS. ORS means at home you can prepare with 1 tablespoon of sugar with a half tablespoon of salt. If you have lemon, you can add a pinch of lemon. If not, mix that salt and sugar with a 1 liter of water. Alter the quantities with the requirement, and once you have to prepare for 24 hours. Once the liquid is prepared, then it has to be consumed within 24 hours. After 24 hours, it is not consumable. It is not good for health. After 24 hours, if there is any leftover ORS which you prepared, then you have to throw it out and has to prepare a fresh thing. Okay, next, how it should be prepared means, wash your hands with soap. Take a clean vessel, mix the solution which I have told, sugar and salt and lemon. Then you have to stir till the mixture dissolves. Later you can consume. Now coming to dose, if your child is less than 6 months of age, then 1 ml must be given in a frequent intervals of time. If your child is greater than 6 months of age, then you can give few drops of like 2 to 3 ml in a 5 to 10 minutes gap. If your child is greater than 3 years old, then you can give him in a glass of tea glass of ORS and ask him to take a few sips at regular intervals. If you do this within 2 days, within 2 to 3 days maximum, the diarrhea or vomiting should be controlled. Mostly diarrhea and vomitings lead to death, not because of the disease or infection. Because of dehydration, the child will suffocate. The child will suffer actually. For not getting into that suffering, for preventing the child from dehydration, you have to give this ORS solution to him. Then we are giving here the body requirements in a proper way, so that he or she must not dehydrate and the disease will cure automatically. If it still persists, then you can take him or her to the hospital. Okay. Along with this, if your child has existing fever, cold or cough, you have to take a paracetamol or appropriate syrup for that symptomatic relief in a weight-based manner. Okay. If you have any doubts regarding the medications in adults, even an Ayurvedic practitioner, I am giving this ORS solution as an informative video, because ORS is the one thing which you have to remember. In the markets, ORS is available in the form of a ORSL. It is mentioned clearly at the bottom of the pack, it is not a WHO recommended formula, then it must not be consumed in a diseased condition. It can be taken in normal cases, but in a diseased condition you have to take only the WHO recommended formula. So at the diseased condition, if you are taking if you are buying an ORS, check whether it is a recommended formula by WHO or not, World Health Organization. So spread this information in your friends and family, because in the diseased condition you have to give the proper electrolyte, you have to correct the proper electrolyte imbalance in the body so that it can rejuvenate to its own, so that your body will recover from the disease as usual. So tell them to buy WHO recommended formula in a diseased condition. If not, they can take it as a normal, not recommended WHO formula as a normal juice. Okay. So indications is it can be taken by any age group along with proper medications. If you follow this ORS, then 2 to 3 days, within 2 to 3 days your disease will get cured. It is the best treatment because it is a low cost treatment. It can be given at home. Immediate treatment you can provide for you or your child without rushing to the clinic. Drink proper water. In the next video, I'll provide you what is an Ayurvedic remedies, Ayurvedic treatments with a doses for a child or an adult, what to be taken in a condition of diarrhea and vomiting along with cold and cough. So for listening to that video, do subscribe my channel, share this to your friends and family, as this is an informative video. They too can get knowledge. Thank you. See you soon in next video.